Hello, everybody. So, today we are going to talk about certain basic signs, symptoms, and clinical based reviews कि clinical history जब हम किसी की लेते हैं, patient history. What all things are supposed to be kept in mind. So, this is designed for the medical students, the junior doctors, and the upcoming budding healthcare professionals. So, the five pillars of the patient interview, the first is the vital, checking the cardiological signs, the heartbeat, right? There's a stethoscope which is being used having a diaphragm in which you check the heartbeats are within 60 to 100. The respiratory rate is within 12 to 20 breaths per minute. You check for the other markers like the tongue, the eyes, right? Because eyes are common markers of diabetes, hypertension, a lot of other diseases. You check out for the kidney and the gastrointestinal symptoms, if any. You ask them for the basic signs and symptoms like the MSs, vomiting, diarrhea, constipation. The abdomen, it's one of the most common signs, specifically, learning about the gastrointestinal, renal, urology, general surgery. Then, if it's related to any movements, articulations, so then orthopedics, musculoskeletal systems, and dermatology, if it's interfacial, right? It's with life cycle related metabolic diseases, or the age related pediatric, geriatric, obstetrics, and gynecology, pregnant women, and the lady, if there's any tract infection, vaginal urinary tract infections. So these are some of the most common things. So the cardiovascular signs and symptoms mostly involve checking for the edema. Many times a person on calcium channel blockers will also have an edema. Edema can be angioedema, cerebral edema, peripheral edema, a lot of types of edema. Checking out for the syncope, whether the patient is falling down, dizziness, palpitations, so hypotension, dyspnea, is there any wheezing noise while he's breathing, paroxysms, right? Checking out for the tightness of the chest. So for, that could be an angina, or ischemic attack, or some minor blood clot. The pulmonary and airways, checking out for the orthopnea, dyspnea, apnea at the night time, checking out for the cough. They're asking for the risk factors, like if the patient is on any occupational exposure or any cigarette smoking. Checking out for the color of sputums, asking for the color of the sputum if there's hemoptysis, blood in the sputum. Neurological status, asking for the facial deviations, checking out for the consciousness, and checking out for the speech, alogia, that's called slurred speech, right? So anopia is loss of sense of vision, anosmia is loss of sense of smell, anorexia is loss of appetite, ataxia is loss of muscular coordination, asphyxia is breathlessness, right? So there are a lot of terminologies that are related to then asking for the memory loss or any visual disturbances and perception disturbances. Abdominal, asking if there's any stools, watery stools or blood stools, or the color of the stools changes in the food habits, if there's heartburn indicating reflux, if there's nauseous feeling, or if there's polyphagia, dysphagia, checking out for the diabetes concomitantly. The abdominal, checking out for the pathological signs like the urine color, pH, and if pus cells or presence of any bacterial infection. Checking out for the burning sensation or the pain, and checking the also the urine output. So the abdomen, many times, after post operative, if there's any surgery, if there's laparoscopy done, if there's gallbladder removal, appendix surgery, or any other surgery, mostly the wound healing takes a lot of time. There's a lot of pain that a person goes through, swelling, especially because many times in laparoscopy you use the CO2, so that gets entrapped, and also there's a swelling as a compensatory mechanism, right? So that is one of the very, very important signs that you need to keep in mind. Or orthopedics, checking out for the joint analysis, if there's stiffness, if there's swelling, if there's, so checking out for the muscle, ligament, this muscle tear, ligament tear, or if there's any deformities, limping, rigidity, tremors. Checking out for sciatica, frozen shoulders, radiculopathy, muscular movement, restrictions of the muscular movement. In the dermatology, checking out for the pus, pustules, oozing, eczema, erythema, right? So a lot of different signs and symptoms to check for. With respect to the hair, alopecia, receding hairline, if there's patchy hair loss, if there's itching, right? If there's scaling, any of these symptoms. So the pediatric, specifically checking out, they are crying, irritability, fever pattern, right? Recurrent infections, if any, the growth, the feeding habits, right? Gynecology, checking out for the period cycle, premenstrual syndrome, PMS is very common, PCOS, polycystic ovarian syndrome, discharge, and checking out for the obesity, abortion history or infertility. Similarly, preeclampsia, signs of the hypertension, where there's visual blurring, swelling of the feet, geriatric giants, mostly urinary incontinence. This is one of the very common problem, and we have betanacol, dariphenacine, and all agents, oxybutynin, commonly given for the treatment of urinary incontinency, right? Then checking out for the polypharmacy if the patient is on drug, food, drug, alcohol, drug herb, or any other interaction, drug nutraceuticals, and the B symptoms. So checking out for the weight, temperature, energy, thermoregulation. So the vital cores involve checking out the basic, if it's you have to first identify that which domain the patient falls into: pediatric, geriatric, obstetrics, gynecology, surgery, recent, if there's any distension, if there's checking out for the basic cardiology, nephrology, neurology, hepatology, hematology, urology, which exactly domain the patient should further refer to, right, for the super specialist or specialists. So this is it for today's video. We'll be bringing out more such informative videos before you. Do check out our channel for more such information. Thank you so much, everybody. Have a great day ahead.